Hello, this is Dr. Radley, family physician in St. George, Utah, and today I wanted to review an analysis that was recently published in the American Academy of Family Physicians regarding outcomes on shoulder surgery. So more and more has come into question of, as we surgerize patients, are we really making a difference in their overall outcome for quality improvement of life, pain reduction, and quality of life years versus the risk of going through surgery. So this was a review of the data that was done and published by Henry C. Berry, MD, MS, professor of Michigan State University in East Lansing, Michigan. He summarized the data from a previous study, Beard, Reese, and Cook et al. At arthroscopic subacromial decompression for subacromial shoulder pain. This was published in Lancet in 2018, and I'm sure that he wanted to re-summarize this data and put it out there because as a provider, you don't want to be referring your patients for something that it's really not going to make any difference but may cause them harm by going through an invasive procedure that they may not need. And the risk of anesthesia, medications, risk of opioid addiction, etc., everything that comes along with having surgery in the first place. So what they were looking at was the question of whether or not having surgery changed the overall outcomes in the long run. So their final analysis said surgery was equal to no surgery for patients with subacromial shoulder pain. So the chromium process is right out here on your shoulder. So they're talking about pain that is below this area in the shoulder. So the bottom line, again, patients with subacromial shoulder pain of at least 3 months duration who received physical therapy showed that surgical decompression was no better than arthroscopy or not less invasive surgery without decompression in improving pain or function, and neither of them were much better than doing non-invasive interventions across the board. So doing surgery really didn't show that much of an overall improvement in outcomes for the long run versus not having surgery. So for those of you who have been having chronic shoulder problems and thinking about going through and having surgery done, I want you to think about that and take that in consideration before you jump to that next level. Have you done everything that you possibly can, non-invasive, to see if we can reduce the pain? Because honestly, they're saying that even if you do go through and do surgery, it may not make a difference anyway. So let's take a little bit further look at the data that they presented. So the adults were randomized into subacromial pain of at least 3 months duration into 3 groups. So patients who went through arthroscopic decompression, so a minimal invasive camera surgery, arthroscopy without decompression, so they still did the scope surgery but they didn't decompress like they normally would, and no treatment at all. Before enrollment, all patients underwent physical therapy and had at least 1 steroid injection in their shoulder during the course of the treatment helped reduce their pain. Patients were excluded who had complete rotator cuff tears. That's obviously a different problem, and we wanted to keep the data as pure as possible. So what they showed was the healthy percentage of patients that were allocated to decompression with arthroscopy versus no treatment did not receive assigned treatment by 6 months because they were already better. So again, did it really make a difference in anything that they were doing? Their shoulder pain had already resolved. Perhaps if we just gave it a little more time, within 6 months your shoulder pain might be resolved. 15% of the patients in the study didn't complete 12-month follow-up, so we're not really sure how they fell out into the data overall. But again, the data was very clear that the patients treated with surgical decompression or arthroscopy without decompression had improvements in pain and function compared to patients who received no treatment, but the difference was not clinically significant or important, and in the long term really showed no true significant difference between doing surgery with decompression, surgery without decompression, or no surgery at all. So again, if you're a patient who has chronic shoulder pain and you're thinking about going in and getting your surgery, and your pain is subacromial, and you're having this conversation with your orthopedic surgeon, be informed. If you're a provider, discuss this with your patients before referring them for surgery. Have we done everything else that we can do non-invasively first to help reduce the incidence of going through surgery when it might not be helpful, and also exposing patients to risk of anesthesia and complications that way. So I hope this information has been helpful. This is Dr. Karen Radley, family physician in St. George, Utah. Until next time, pura vida.